57-year-old Kepher Okundi has lived to tell. 32 years ago, he tested positive for HIV in what is now Homa Bay County. Then, the mere mention of the virus could consign one to an early grave. HIV and AIDS patients were immediately associated with promiscuity and were generally shunned by the community.
People were dying, and people did not go for their medication. HIV was a big issue. If people heard that you were positive, they would run away from you, thinking standing next to me will infect them.
But Kepher had the will to leave, and not even the stigma could put him down.
I was admitted in hospital for 2 months. I lost memory. And speaking English, Swahili or Luo became difficult.
According to a report by the National AIDS Control Council, Kenya registered 41,408 HIV infections in 2019. 62% of the total infections were registered between the ages of 15 to 29 years. Homa Bay County taking the lead with an 18.5% prevalence, Kisumu at 17.3%, Siaya 16.2%, Migori 11.8%, and Busia closing the top 5 with 6.7%.
For now, if I go to any gathering and I disclose my status that I'm HIV positive, there's those people that will still view me in a perspective that I'm a curse in the society.
And with the World AIDS Day being marked in Nyamira, Health Principal Secretary Susan Mochache insisted that the war against HIV and AIDS was still far from won.
Tunapofanya uzinduzi huu kuhakikisha kwamba fedha zinatengwa za kutosha kuweza kuingia katika jamii zetu, kuweza kuwasaidia akina mama na hata akina baba wale wako peke yao wanaishi na ukimwi.
Nearly 40 years since the virus showed up in Kenya, stigma remains the drawback in the fight, forcing many to never disclose their status or seek treatment. Raquel Muigai, Citizen TV.